All right, directors, we'd like to, thank you. We'd like to go back into closed session. Open session. I'm sorry, I had you all. We just sat down. We just sat down. Appreciate it. No, thank you all for your patience this morning. We all still recovering from all the activities of the week. We appreciate it, but we would like to go into open session at this time. At this time, I'd like to entertain a motion to approve, subject to the advice and consent of the Cook County Board of Commissioners, the appointment of candidate A to the position of Chief Executive Officer of Cook County Health and Hospital Systems pursuant to the compensation package discussed in closed session.
Mr. Chair, I will make that motion.
Do we have a second? Second. Thank you. The motion has been made and seconded. Is there any discussion on the motion? Thank you. All in favor?
Aye.
All. Thank you. Record. Directors? All opposed? Thank you. The ayes have it. The motion carries. Thank you very much, directors. The next item on the agenda are the board and committee reports. The minutes of the July 26th board meeting are being presented for your approval. Are there any corrections or revisions to the minutes?
Mr. Chairman, I move that we accept the minutes as presented.
Second. Thank you. The motion has been made and seconded. Thank you. Is there any discussion on the motion? All in favor? Aye. All opposed? Thank you. The ayes have it. The motion carries. Next, we're going to go out of order, directors, today. Director Ryder will review the first set of Finance Committee meeting minutes.
Mr. Chairman, for the July 26, 2024 Finance Special Meeting minutes, the proposed Cook County Health 2020-25 preliminary budget was introduced at that special Finance Committee meeting. At the introduction, two subsequent public hearings, Pam Cassara, our Chief Financial Officer, provided an overview of the presentation, and then the committee received public testimony. There are 4 public speakers who testified at the hearing on August 2nd, and 8 speakers testified at the August 5th hearing. Pam has provided this presentation a number of times, so I'm not going to ask her to do it for the millionth time.
Oh, no, Pam was just waiting to come to the chair.
I know, she's dying to do it. So at this time, the minutes of the Special Finance Committee meeting convened on July 26, 2024 being presented for approval. There were no action items associated with this meeting, as the meeting was held for informational purposes. Perfect.
So I'd like to entertain a motion to approve item 4E, the July 26th Finance Committee special meeting minutes.
So moved. Second.
Thank you. Motion has been made and seconded. Is there any discussion on the motion? All in favor? Aye. All opposed? Thank you. The ayes have it. The motion carries. Director Ryder, stay there. Director Ryder will now review the August 15th Finance Committee meeting minutes.
Mr. Chairman, the Finance Committee met on Thursday, August 15th at 9 a.m. The next meeting of the committee will be held on Thursday, September 12th at 10 a.m. The committee considered the following action items, which are included in the minutes. Approve the proposed Cook County Health 2025 preliminary budget. Conditionally approve 15 contract and procurement items. Number 2 is still pending review by contract compliance. On the screen, you'll see the contractual requests on the Finance Committee meeting whose fiscal impacts are greater than $1 million, which are highlighted for your information. We received and filed grant award related items. The committee received the following reports, which are also included in the minutes. 1 emergency purchase was reported, and we received the report of the June 2024 financials. As I said earlier, Pam's done a great job of presenting the presentation at several iterations of that Special Finance Committee meeting, and at I believe we still did it at the last regular Finance Committee meeting. So I am now, asking that if there are no other questions, minutes, to be presented for the board's approval at this time.
Thank you. I'd like to entertain a motion to approve item 4E, the August 15th Finance Committee meeting minutes, which contain the following action items: approval of the proposed CCH fiscal 2025 preliminary budget, approval of the contracts and procurement items, and receiving and filing of grant award-related items.
So moved. Second.
Thank you. The motion has been made and seconded. Is there any discussion on the motion? Hearing none. All in favor? Aye. All opposed? Thank you. The ayes have it. The motion carries. Thank you. Next, Director Harrington will review the Audit and Compliance Committee meeting minutes.
The Audit and Compliance Committee held a meeting on Friday, August 2nd at 10 a.m. The next regular meeting of the Audit and Compliance Committee is scheduled for Friday, October 18th, 2024 at 9 a.m. Nicole Emerald, Chief Corporate Compliance and Privacy Officer, reviewed the report, which included information on the following subjects: highlights of first and second quarter county FY 2024. That included system compliance program and the Cook County Care Medicaid Health Plan compliance program, as well as their recovery. And the last part of that was a privacy update. The committee did go into closed session to receive the closed meeting report, but we do not anticipate re-reviewing that today, so the minutes can be approved at this time.
Thank you. I'd like to entertain a motion to approve item 4B, the August 2nd Audit and Compliance Committee meeting minutes.
Second.
Thank you. The motion has been made and seconded. Is there any discussion on the motion? All in favor? Aye. All opposed? Thank you. The ayes have it. The motion carries, Madam Secretary. Next, Director Curry will review the Managed Care Committee meeting minutes.
Managed Care Committee met on Friday, August 2nd at 9 a.m. Next regular meeting of the Managed Care Committee is scheduled for Friday, October 18, 2024 at 10:30 a.m. Reports and metrics that the committee reviewed and discussed included information on the following subjects: the health plan metrics, health plan successes, NACO Award, and Astor Judge's Choice Award, Quality, HEDIS 2023, Quality 2024 CAPS, and strategic initiatives and priorities, including the 1115 waiver update, lead water filter benefit, redetermination outcomes and redetermination events, food care, non-emergency medical transportation transition, value-based strategy, and the marketing campaign. If there are no further questions, approval of minutes is being requested.
Thank you. There's a lot in the package, by the way, directors. I'd like to entertain a motion to approve item 4C, the August 2nd Managed Care Committee meeting minutes.
Motion to approve the item.
Second.
Thank you. The motion has been made and seconded. Is there any discussion on the motion? All in favor? Aye. All opposed? The ayes have it. The motion carries. Thank you. Next, Director Bott will review the Quality and Patient Safety Committee meeting minutes.
Thank you, Mr. Chairman. Good morning. The Quality and Patient Safety Committee met on Thursday, August 15th at 10:30 a.m. The committee approved the following action items, which are included in the minutes. Approved 1 Stroger Hospital Department Chair initial appointment, 1 Stroger Hospital Division Chair initial appointment, and 5 Stroger Hospital Division Chair reappointments. Also approved Stroger and Provident Hospital medical staff appointments, reappointments, and changes. Approved proposed amendments to the bylaws of the John H. Stroger Junior Hospital Cook County medical staff. Note, with regard to the amendments to the medical staff bylaws, the committee plans to work with the medical staff leadership on some additional changes that can enhance our ability to meet the needs of our clinicians, patients, and community. The committee received the following reports, which are included in the minutes. Updates from operational excellence work groups, including throughput Stroger Hospital, throughput Providence Hospital, patient experience at Stroger Hospital, and patient experience at Providence Hospital. OpEx dashboard received regulatory and accreditation update. Next meeting of the committee is September 12th at 11:30 a.m. The committee received an informational report, closed session, but is not expected to be re-reviewed. There are no other questions on the minutes. They're being presented for the board's consideration at this time.
Thank you. I'd like to entertain a motion to approve item 4D, the August 15th Quality and Patient Safety Committee meeting minutes, which include the approval of 1 Stroger Hospital Department Chair initial appointments, 1 Division Chair initial appointment, and 5 Division Chair reappointments, approval of the Stroger and Providence Hospital medical staff appointments, reappointments, changes, and approval of the proposed amendments to the bylaws of the John H. Stroger Junior Hospital of Cook County medical staff. Wow. Do we have, thank you.
Second.
Thank you. The motion has been made and seconded. Is there any discussion? Okay. All in favor? Aye. All opposed? Thank you. The ayes have it, the motion carries. Thank you for not making me read that again. I'll appreciate that. Next, we do not have any contracts being presented directly to the board for consideration, so we can move on to the next item, which is my report before your report. My report's very brief. First, I'd like to thank the search committee for their diligent work and engagement throughout this process as we went through identifying, evaluating, and selecting the next CEO for Cook County Health. I'd also like to thank the full board for your help and support. You know, we had a lot of meetings and a lot of feedback and engagement, and thank you. It's really appreciated. Okay.
Good morning again, and thank you, Chair Taylor. Let's see, we'll get the slides going here. The plan was to provide a deep dive on ARPA, knowing that we had a full agenda, Chair Taylor and I discussed, and I think we are going to move, we have project by project, a summary in the appendix of the slides. We'll move that to the meetings next week, the briefings. So if there's any questions, we can do the deep dive there. I'll just give a kind of a high level of where we're at in terms of hiring and spend. And then we have one quick slide with Alex about our brand refresh. So that'll be the agenda. Next slide. So that's our current spend. So we have our expenses, there's 137 million left, and then our obligation, 97 million left. As a reminder, we have to obligate by the end of 24 and expense and spend through 26. So we have almost 2.5 years left for the expense. Oh, we can't? Oh, okay, all right. Well, we have the team here, so we'll do the review here. Okay. Of note, the obligation and expense next Friday will be signing off on all of the subrecipients for the Stronger Together, so that'll be a full 44 million that'll move in 7 days.
So yeah, that's why I want you to go deep down.
Yeah, okay. And hiring, which I know has been kind of the main topic. So this is where we're at right now. That gray bar that's been declining is what is left. We have 49 positions in HR right now. I'm happy to say 88% of them are at the tail end of the validation phase. So we have 13 of those 49 are offers accepted. 19 have what we call a DTH, decision to hire. So that's the step right before we make an offer. And then 11 are interviewing. Those 6 that are outside that post-validation phase, we're anticipating to transition funding into either subrecipients contracts or patient support. But I will say, as we go through each of these, there's a plan under each project. If the staffing can't happen, each project leader has kind of a plan B of what to do with the funding for those positions. So we will not be losing any ARPA dollars. Next slide. So that's kind of the next steps in terms of 24 activities. As I mentioned, finish out hiring, and then we're bringing online a sustainability working group that'll go project by project and decide what the plan will be come 2026. What are we bringing on the hospital budget? Where can we potentially find other grant funding to continue the work beyond 26? And then potentially what projects do we need to let go of? And then lastly, I kind of mentioned the 53 subrecipients. Oh, sorry, can you go back for a sec? The 53 subrecipients for behavioral health, that'll be signed next Friday, and then the rest of the year we'll be spending obligating and figuring out the contracts and subrecipient agreements.
And so that's the 44 million for the,
The second one, the 53 subrecipients will be getting the 44 million, yes.
okay. And we feel comfortable about getting it out? I see you shaking your head.
Oh, yeah.
Okay, thank you.
And then, I don't know if we want to jump to the appendix and we'll go through each of the sections. And then we can come back for Alex for the brand refresh. Okay. So who was our first? I think Shannon, were you our first presenter?
Welcome to the table, Shannon.
Good morning. Good morning. Can everyone hear me?
Good morning.
I just have two slides to speak to today. The first is for food as medicine. We're happy to report that we were able to fill 2 of the 3 vacancies. Dr. Makaitis reported earlier in his report out that we just welcomed a new food security program manager on July 28th. And we are super excited about having someone dedicated now to our efforts of rolling out our 2 pilot programs, one being the Belmont Cragen Food Pantry. We're happy to report that the construction has been completed for that, and you can see on this slide some of the metrics that we've accomplished to date. But now that we've got that dedicated resource, we're encouraged in terms of being able to really ramp up, if you will, on delivery of that. In addition to that, we've identified an additional opportunity at Providence Hospital, working directly with some providers about doing a version of a pilot program related to prepared meals for folks who are in programs to address various issues, including AC1 reduction and high blood pressure reduction. The next slide, and last slide, is for Housing for Health. We've had a correction to this since earlier this week. We've actually filled 2 positions, and we have 2 vacant. One of those positions is currently in process with the HR department, and the other vacancy will have to be repurposed, and we are already working through, we've already identified a space within this very robust program to utilize those dollars. This program, differently than the food initiative, is something that was already in place, and the ARPA dollars allowed us to enhance our efforts, not only with our flexible housing pool and to provide additional resources, but it also gave us dollars and ability and staffing with our RISE program that many of you are familiar with, that's located in Oak Park. We've been able to add an additional resource there. So we are encouraged and excited about the continuation of this program and about the new resources that have been added to food as medicine. Are there any questions?
One question, just curious, part of this is intercepted in, as, you know, as patients come in, do you have a sense of like how many patients we've engaged with over the last year, or what's the, to support housing?
Yes, actually for both of these, we have very strong metrics. I will say that up until, for the first program, for the food program, simply because we're standing up the infrastructure, while we already had very strong programming with our partners with the Chicago Food Depository. And so we have very real metrics about the volume of food and the impact of patients throughout the system in terms of participating in the program. The dollars with ARPA, and where we've already started collecting some data, but again, not as robust as in the housing space, is looking at very specifically through our programs with endocrinology and cardiology, the impact of the food efforts around the food pantry and the partnership and the growth there. So we're looking forward to having, again, more robust numbers, but in the housing program, we've got a number of data points as it relates to the impact of, and it's not only the flexible housing pool, where that relationship and that program has been in place, since prior to COVID, but as well, the RISE program and the number of people, that through our partnership with Housing Forward, we've been able to impact. And I'm happy to provide, even more in-depth information on the work that we're doing there.
Yeah, we can go deep dive at one meeting, that'd be great.
Absolutely. Thank you.
Thank you, Shannon. I think, Dr. Hasbrook, are you next?
All right. So, good morning.
Good morning.
And
Welcome to the table.
board. I have a few programs for you today, 12 to be exact. So I'm going
Did
to.
you say a few and then said 12?
Yes,
Okay.
yes. It's all about perspective. It's about perspective. So I'll walk you through it at a high level, but I'll just say initially that we've had a number of internal meetings with our team and our managers for each of these programs. We feel good about the plan that we have and the contingency plan, should things slow down a little bit in terms of transferring the money inside the shop. So I'll just walk you through these at a high level. So the first one is lead poisoning prevention, budgeted at 3.8 million or so. We've spent 50% of that. Currently, there's one vacancy that we plan to hire. This is really our lead program, and really for supporting staff to do the lead remediation work throughout the community, which includes prevention education as well. And some of the metrics are down there below. I'll just highlight the one in terms of the number of units that were identified, and then from that number, depending on if the household is eligible for this program, which is low and middle income, or if they actually apply, we actually will then go and remediate them. So we've removed lead from 50 houses during this most recent period. So that's that one. Go to the next one, which is opioid overdose and substance use prevention, budgeted for 8.7 million. We've spent 17% of that, obligated 71% of that already. There's two vacancies here that we want to hire. One is a program coordinator, the other is an epidemiologist. These are going to really focus on our data efforts, using and analyzing opioid-related data. A lot of that data comes from the Office of the Medical Examiner, so we can direct our efforts. The funding is to expand existing prevention activities. It includes a very robust naloxone distribution program, and harm reduction services, focusing on the south and west suburbs, and then leveraging the data sources for prevention efforts, and that's where those two staff come in. Again, highlight some of the metrics down below. Nearly 8,000 naloxone kits given out, nearly 6,000 trainings done on naloxone, and then some referrals as well. Go to the next one. Mental health hotline, budgeted for just under 1.5 million. We've spent about 20% of that, obligated 100% of that. This is a partnership with NAMI, the National Alliance for Mental Illness in Chicago, and it expands their already existing hotline that they use to serve the city of Chicago to suburban Cook County residents. And so it really will provide service to suburban Cook County residents through the end of 2025. And you can see, again, specifically for suburban Cook County, we've had referrals of about 1,700, is one of the metrics I highlight here.
Is that expected? Is that kind of how you were thinking about the level would be, or?
The 1,700?
Yeah, is that low, high? How should we
Yeah,
think about that?
that represents about, 700 independent callers. And so I think what it tells us is that callers at high need call repeatedly. And it also kind of gives us a baseline. We had no idea how much need there is out there, and then how many folks would avail themselves of this particular hotline, which basically just kind of does triage and connect you to services.
Okay.
So it gives us kind of a look into what the need is.
Dr.
Yes.
Hasbrook, are you seeing a disproportionate number of particular set of conditions? So is it depression versus anxiety?
I don't know the answer to that. I'm sure we can dive into that, and yes, segregate it or categorize it for you, but I don't know that the team has actually done it yet. Yeah, that's a good call out.
So Dr. Hasbrook, does this
Yeah.
in any way tie to the national mental health hotline that's out there?
Yeah.
Is that-
Yeah, so NAMI is a national organization, and then there's chapters. And so Chicago is the largest chapter. There's one in suburban Cook in the south side that we work with as well, or south suburban, that we work with as well for other initiatives. And so they all kind of feed up to that. They kind of take their mandate, their framework from that. Yeah.
Thank you.
You're welcome. Okay, no other questions on that one. We'll go to the next program, which is Building Healthy Communities. We had two folks come in and give some testimonies today, which was nice, nice to hear. So this is, what's that? Oh, plants. No. $6 million here, for this one. 86% of that has been spent. And you guys know about this program. We had 23, community-based organizations that were funded. This program is really officially, ended. But we've been able to kind of repurpose some funds from some other ARPA to extend some of those, grantees. In addition, CCH awarded $1 million to 13 CBOs as well. So again, you see those very impressive metrics there. Number of meals, about 1 million meals, just under 1 million meals. People service, 156,000, et cetera. So the balance of some of these funds are going to be used to do some other health and racial equity work in suburban Cook County. So we have a vendor on tap that's going to help us engage with some what we call community power building organizations to help kind of uplift some of the equity work that we're doing. That's good work. Next program, Good Food First Thing program. You guys also had a presentation on this from our team, and this is $4.5 million, been 10% of that, but we've obligated 43%, and it really focuses on procurement strategies for Cook County Health, Cook County Juvenile Temporary Detention Center, and Cook County Sheriff's Office, using principles for sustainability and supporting local food providers, et cetera. And so this work is ongoing. We have some of the metrics down below. I'll highlight the 5 buyer-supplier events that we had, sponsored by Chicago Food Policy Action Council. We also have a number of vendors contracted to continue this work. So it doesn't look so impressive in terms of the spend right now, but we have an executed vendor, another vendor that's already been executed that we're amending, and then we have a number of IGAs that are going through the process to work with CCH, as well as the Sheriff's Office and the Juvenile Temporary Detention Center. So just working out that language, and then we expect those to really take off. Next program is Suburban Cook County Worker Protection Program, $7.8 million, 7% spent, 23% obligated. And this is really work that we're doing in the community to equip employers and workers, mainly precariously employed workers, support policy changes that promote their rights, their health, their safety, connecting work to health as well. And so we have a person that's been hired recently that's going to start early next month. And we have a number of coalitions, 13 partners that are engaged in really focusing on kind of the next phase of this. So we started with some pilot phases on this, and then we're going to be scaling this out, focusing on training, surveillance, and some of the regulation of violations, and then work in terms of education for both workers and employers. And I'll just highlight the number of workers that have been reached so far, 93,000, and just under 300 violations that are being tracked. Wow. Next program is, happy to say, hyperlocal and in-home vaccination, which is done. Okay. So we'll move on from that one. Finish the work, all done. Next one is Community Health Workers program that's just under $2 million. We have obligated 89% of that. This is a community health worker model. We call it community health promoters at CCDPH, basically helping to improve access to health care and access to social resources and health education in suburban Cook County. So there are those connectors out there in the environment, helping to get folks into care. And so we have the work in growing this program, as well as some support around what we call organizational health literacy, helping organizations to be more approachable and accessible to folks by lowering some of the barriers to access, helping folks understand how to navigate and use the various resources. So we're using some of the money to do that as well. And we have some positions that we're supporting that are already existing, already hired, already on staff, which are listed there under the hiring status row there as well. And then we have 2 vendors that are also doing work for us in the area of training community health workers. As you all know, there's a state certified program, learning collaboratives, creating and expanding that. And we have another vendor specifically for our, called Literacy Works, that helps us with our organizational literacy, program, health literacy program. Okay, moving to the next one, behavioral health expansion, $22 million. We did a presser in this room where we awarded 24 organizations. This is the other part of the Building Healthy Communities, community grant program, but these recipients really focus on the behavioral health work. And so I'll highlight over 3,000 clients that have been referred to additional services through this program. Next, emergency preparedness, and so obviously, so just under $4 million, 9% spent, and we have 2 vacant positions. We filled 5 of them, 5 positions. We have 2 yet to be filled. Importantly, a lot was uncovered during the COVID pandemic, and understanding that we need to build our emergency preparedness unit, and so this funding really supports a number of staff. We've hired an inventory manager. You all know you all approved a new warehouse for us to put PPE and other things like that. So we hired that manager, inventory manager, a manager of emergency operations, emergency response coordinators, program coordinator for training and exercise. It just gives us more bandwidth and capacity and expertise to really build up that unit so we can respond, prepare and plan, and then respond to emergency events. And so highlight the number of participants, people that have been serviced, just under 11,000 so far.
And related, when is the warehouse expected to be complete again?
Q4. Yeah, the renovation. Yeah, thank you. All right, and we'll go on to the next one, which is the crisis intervention program. Just $500,000 here, 58% have been spent, 61% have been obligated. And this narrative here, we've pivoted from this work. It was going to be kind of like a crisis intervention pilot that included, street health intervention specialists and medics trained to kind of respond and de-escalate and redirect stuff. We've kind of repurposed this money to the following programs down below, which was really more of an assessment, 2 assessments. So one, we're collaborating with the Office of Behavioral Health, Dr. Nutter, who we hear from in a minute, to do a countywide behavioral health workforce assessment. Those findings will be presented at a symposium that's coming up in October that we're working together, collaborating with doing. And then also another vendor has been contracted to do an assessment of the crisis response space in suburban Cook County, and that work is expected to started already. Is expected to be completed in 2025. So kind of a new scope. Repurposing the money, making sure it still addresses behavioral health, but just in a different way. And then I think the last one, again, is all done. It's our contact tracing initiative, and that work has been completed. So happy to take any questions.
All right, thanks, Dr. Haddad.
Thank you, Dr. Hasberg. Just appreciation to you and the team. And advancing best health for everyone is a team sport, as you know, and I think there are good examples here of coordination between health system, public health, and community-based organization. And that, so just curious about the different coordination points that you all have engaged in, whether it be county care, quality patient safety, et cetera, and more opportunities to do that.
Yeah. So you have, is that a question or just?
Yeah. Well, I don't know how much, to what extent you have or not, or if that's in the plans, because I suspect that there's overlap between the people being served in these programs and the people that are showing up in county healthcare sites and programs.
So, as you know, one of the foundational public health services is really to do referral in the community. We're working at the level of the community. And so our community health workers would be a great example of that. There are some here in CCH and there are some in CCDPH. And there's a lot of overlap in terms of how they do their work, how they plan their work, and how they kind of model the different things that they're doing. So again, our extenders out in the community, and in fact, the gentleman that was managing our community health workers is actually embedded in CCH and helped to start their program in 2019, and then kind of came over to help us do our work. And so that work is expanding, that scope of work is expanding. I think we're sharing there a lot. There's probably more opportunities to do that. And then another, obviously, the Office of Behavioral Health, that's another good example. So as we've been building up our behavioral health, community behavioral health unit, working with Dr. Nutter and his team, In terms of some of these grant programs, also in terms of the large summit that happened, and also this new summit that's going to be happening after this workforce analysis. So working together on calls together, not only with him, but also with our colleague, Simbo over at the Chicago Department of Public Health, and folding them in terms of what their plan looks like. In particular, opioids has been a big area of concern, or collaboration. But I think there's more opportunities to do more collaboration, and Dr. Makaitis and I have talked recently on some one-on-ones about getting a quarterly kind of cadence going where we can actually lay out some things in terms of mutual collaborative efforts.
Yeah, it seems to me to be part of a good impact story of public health impacting health outcomes, and the healthcare delivery system. Thank you.
Yeah, related to that, could you say more about your evaluation plan? Because, building healthy communities.
Yeah.
And also, I know that you had a Healthy Cook County survey, right, last year?
Yes.
So I'm wondering, that sort of like community-wide survey could be part of your evaluation plans going forward.
Yeah, so we have a lot of things going on in terms of evaluation. So you may be familiar. You mentioned the Cook County Health Survey, which is very similar to the Chicago Health Survey, and our Health Atlas that keeps all that information. So we probably have funding to do that every other year, and that pulls in a lot of good data, for behavioral risk factors and the like. And so we have been sharing that information with the community. We've been writing different briefs on different conditions. We've been trying to drive traffic to our atlas so folks can actually use them. We're in the process of doing a number of different communiques and newsletters and things, using some very powerful tools to interact with the community. But all that's embedded in our larger strategic plan, which is called Putting the Public in Public Health. And from that plan, which is published, which was released last summer, and from that plan, we have begun to identify metrics that matter. And so it's all the metrics that's going to allow us to use our strategic plan and those pillars to evaluate where we're going with that. And then, of course, as you all know, we have the community health assessment that's coming up, which is our WE plan, our large community plan, and that is coming up in the next year. So we'll be refreshing that as well. So there's a lot of work and activity going on in terms of measuring the impact.
Thank you.
Happy to share more too.
Yeah, I actually don't have a question, but it's probably more of a request, because I've been listening to the presentations and what's on the table, and given the amount of funding that we're throwing at these issues and the resources, is there a way, some kind of way to look at what the collective impact of all this work is created? I mean, because we seem to be chasing something that we never achieved. Is there a way to take a step back and look at the collective impact of what we're doing as opposed to looking at the success of individual projects? So I'm just putting it out there, but because I know there can't be an answer today, but it would be good to really look at what we're doing and what has been the collective impact of this investment in dollars and resources moving forward.
Yeah, we can certainly explore that. I think, looking at broader populations, kind of the outcomes, right? Disease prevalence, all of those, but, obviously those are going to be things that take a longer time to really show. So, but yes, we can think about how we can measure broader impact, absolutely.
Thank you, Holly.
Other questions for Dr. Head? Okay.
All right,
Mark.
thank you.
I think we have Dr. Nutter next.
Speaking about the big budget.
Morning, Directors. Tom Nutter, Chief Behavioral Health Officer for Cook County Health. And I just want to reiterate what Dr. Hasbrook was just mentioning, in that the Workforce Symposium will be October the 1st at Malcolm X. You should all be getting an invitation to that in the next week or so. Happy to report that I'm presenting on 2 slides this morning. The first is the Cook County Behavioral Health Services. That's the funding for the Office of Behavioral Health. You'll see total budget of $74.1 million, and as of this slide, only 4.8 spent and only 12% obligated. However, as was mentioned earlier, There are 44 million in the Stronger Together grants. We anticipate that those will be fully executed by the time we meet next. I've personally signed 51 of the subrecipient agreements now, so Dr. Makaitis, you're going to have a busy week of signing next week. The other two we anticipate coming very soon. There are 53 total awardees for those grants. So with those, with the awarding of those grants, we put the obligations about 70%, and as was mentioned earlier, significantly move the needle on the ARPA obligations in total. The news is a little less rosy on the positions. You'll see there were 51 positions currently ARPA funded. One of the 17 that is listed as filled, there's 17 that are currently filled. One additional one was filled and is being, we're in the hiring process of getting that person on board soon. Of the other 33 vacant positions, I'm happy to report we have an 8th or 9th inning rally in place. We have 7 folks with upcoming start dates. As of this morning, 6 more who've accepted and are awaiting start dates, 9 additional decisions to hire that have been submitted in the last few days, and the 10th will be submitted by the 10th and final one by the time this meeting ends this morning. So thank you to Mr. Dabney, in particular, and his team in HR, to Mr. Dabney to my right, for all the work that they've done this week and all that they're going to do in this next week. It's been a busy time. And we do anticipate that with the staffing being onboarded, that we will be able to staff appropriately the CTSC at Provident, as well as our office, and also bolster CCH outpatient services. Metrics, as was mentioned earlier, we do have the awardees. The summit, as you all are aware, took place in February. We have about a dozen other projects funded through this initiative. And on the topic of metrics, I did have a chance to review the metrics that will come forward for the strategic planning, or the Stronger Together grantees. There will be about 400 metrics that we're tracking, and many of those are outcomes based. They are not at the level that Director Harrington was referring to in terms of all rolling into one, but I was encouraged by not only the number of metrics and the level of detail, but also the number of organizations that have outcomes measures in the subrecipient agreements. Any questions on TRO 11, the Office of Behavioral Health? Okay, moving on to the next one, which is additional behavioral health personnel and support at existing clinics. Thank you in particular to Ms. Castillo, the Director of Ambulatory Behavioral Health and Social Work, Ms. Castillo to my left. These funds were used for ensuring that there are mental health providers in each of the ACHN clinics, and what funding was also used to enhance the training of those folks. They received additional training in substance use disorders, in child and adolescent topics, as well as some training in evidence-based psychotherapies, including time-limited psychotherapies. As you can see, she's been was successful in her hiring in the 4th or 5th inning. And has not only has the 18 that were filled, one of them was previously filled and is being refilled, and I'm happy to report that the 20th was going to start on Monday. She's delayed, I believe, and will start in 2 weeks. So congratulations to Ms. Castillo on your great work and stewardship.
Thank you very much.
Any questions? Thank you. All right, thanks, Dr. Nutter. We have just a handful left that were kind of one-off, so I'll just take those. Healing Hurt People, it's a trauma-informed violence intervention program in our trauma unit. It outreaches to patients and families affected by intentional violence. The purpose here is to support and try to kind of truncate that cycle of continued violence. We've had 245 patients in the first half of this year engage in the program. A total of 679 come through the trauma unit, so about a 36% penetration, and 19 of those have continued on in a kind of a robust follow-up peer support group, 112 sessions at almost 900 hours of service. It's called Self, Safety, Emotions, Loss, and Future. 8 positions are filled there. We have 5 vacant, but they're all at a decision to hire point, so essentially that step again before an offer is being made. So we anticipate, unless there's declinations, we'll have them filled. The Plan B here, if we don't have them filled, is to shift to patient support for funding. Next slide. This This was the vaccine incentive program. It's complete, obligated, and expended. So this one is done. Go to the next slide. We have care coordination with HAC, the Housing Authority of Cook County. We're providing behavioral health specialist support in partnership with the Housing Authority. The intent here is to bring behavioral health care to the patients for those who are most marginalized and isolated. We've engaged 2,666 residents. 1,200 were, a little over 1,200 were connected to external services. 174 are receiving additional preventative and standard health care. This is fully obligated with about 2.4 million left to expend through 26. Next slide. Youth juvenile justice collaboration. This is kind of upstream intervention, again, for violence intervention. It's to try to avoid justice involvement. For the youth, we've had 169 total referrals. 75% have graduated successfully, and the top 3 referral services are counseling, workforce development, and mentoring. We have 2 of 2 positions filled here, and this is 100% obligated with, looks like 5.1 million left to spend down. Next slide. Oh, that's it. Okay. Can we back up for the brand refresh for Alex?
Yes. Welcome, Alex.
Thank you. Good morning. Alex Normington, Interim Chief Communications and Marketing Officer. I am closing out the day with one slide.
Thank you.
All right, you will see, you might have noticed in your materials today that they looked a little bit different, and that's because we are undergoing a brand refresh that will be launching in early September. A periodic brand refresh is the best practice. It helps keep your brand modern, and it also helps you re-engage with both your current and new audiences. So one of the most exciting things for me as part of this process was developing a tagline for Cook County Health. Now, this is branding for Cook County Health as an enterprise and as a provider of care. The County Care and CCH brands are maintained separately, but in coordination with our parent brand. So this tagline is accessible, exceptional for all. We feel like these few words encapsulate our brand promise and speak directly to the patients that we serve. And we're going to start implementing this and using it in our marketing materials soon. We also have an updated color palette. We did some market research and strategically decided to lean into blues as a differentiator for us. So we've got a few new shades of blue in our color palette and some new accent colors. And where I'm really going to nerd out is on our new font, Atkinson Hyperlegible. This is a font that was developed by the Braille Institute and was named after the Institute's founder. And it was designed to be a very a font that was very well readable for individuals with low vision and to improve comprehension among readers. So this is really important for us as we think about patients who may be speaking or reading English as a second language or maybe reading at a lower grade level. You'll see that this is a sans serif font with some glyphs that really make every character distinct. So you're not going to confuse a lowercase I with a lowercase L. Everything is going to look unique to really make sure that people can read what you're presenting in front of them. So we're going to be using this font in all of our patient-facing materials moving forward. And we're really excited about that. On the right side, you'll just see the application of the brand refresh in a few different ways. We have also been working really hard on a website redesign. So this will, these brand standards will move over to our website as well in September. And we've updated not only the content on our website, but we have improved our user experience. So we think that the new site will be much more user-friendly for patients and people who are coming to our pages to find more information. We've also created a brand center, which we'll be sharing with staff as part of the refresh, where staff can download the fonts, brand materials, collateral that they may want to share with patients, stock photos, templates, all sorts of things in one one-stop shop place on our intranet site.
And all of this happens in September?
Yes, we'll be launching in early September. So to that end, I'd like to thank our partners at Res Publica Group that have been supporting this work and our small but mighty communications team. This is a very all-encompassing endeavor. Particularly Luis Alvaray and Cheryl Booth Davis have been working really hard on making this a reality, and we're very excited. Can I answer any questions?
Yes, I'm assuming this was a team effort, and there were a lot of people involved in this and vetting and moving forward. But the tagline is accessible, exceptional for all, and that's connected to our mission and vision moving forward. So it's all, okay.
Absolutely.
Thank you for the work on it.
You like it?
Thank you.
I'm working with you.
I was like, reaction?
The thing I really like about the tag is not only does it really synthesize what we stand for as a provider of care and as an enterprise, but it also makes us a little more consumery. So we're walking and talking a little bit more like our nonprofit peers who have taglines in a lot of their materials as well.
But I'm, and building off that, then I'm assuming that we'll be covering these issues or these items in our marketing moving forward to reinforce that this is who we are, that these are the things we do. Yeah, so,
Definitely.
yeah, right.
Thank
I'm
you.
working with you.
All right, thank you, Alex. Back to work. My report.
Thank you. We appreciate it for a comprehensive report. There's a lot of slides. I'm sure there are follow-up questions. The next item is review of the Human Resources Committee metrics by Interim Chief Human Resources Officer.
Good morning, everybody.
Good morning.
All right, so we have our monthly metrics to provide to you as an update.
Mhm.
And as this slide shows, we have about 1,800 positions that are currently vacant in the organization. 1,220 plus of them are in HR being actively worked to fill them. There is a large number that were recently or are in the tail end of their posting period, so we'll be pushing those into the recruitment phase over the next couple of weeks. But then the bulk of our positions are in the interviewing and selection process right now, that decision to hire bucket as well as the interviews in progress. And so as Dr. Markaitis indicated earlier, that decision to hire phase is where we are prepping to make those offers to the candidates. And then as you can see in the blue bar, we've hired into 743 positions, which we'll give a little bit more detail on the next slide. So this shows the 743 positions we've filled as of the end of July with a 65% offer acceptance ratio that is holding pretty steady. And it leads us to a net new gain of 173 positions in the organization. 500 of that 743 were external positions, and that helps us push that net gain farther. And on the next slide, I believe, oh, no. Next slide is the separations data. Separations data shows that we are continuing that trend of decreased separations year over year over the last couple of years. We are at 328 separations as of the end of July. And we have an 18% decrease from last year on separations for the same year-to-date data. So our hiring fairs, we've held 17 of those as of the end of July. And we've had 86 hires that as of the end of July had already started. 41 new hires had already accepted and had orientation dates. Many of those actually have gone through orientation this month in August, with a few that are also going to be starting in early September at the next orientation dates, leading us to a fiscal year to date 122 hires total.
And for the hiring fairs, this includes nursing hiring fairs as well?
Nursing is included in our hiring fairs, yeah. Yeah.
What's an internal hire? Somebody moved to a different position?
Yes, and it could be somebody lateraling from another area of the organization because of our different, public health kind of.
You just made me think of an additional question. You said we have a 65% acceptance rate overall, right?
Overall for all types of hiring, yes.
What's our acceptance rate internal?
For the hiring?
When we offer internal, do we often get declined? What's our acceptance rate?
We do, because some internals are applying to multiple positions, and so yes, we will get some.
Can I go back to the initial vacant positions slide?
Yeah, that was our first. One more?
Here. If I'm reading this correctly, from quarter one, 1776 total vacant positions, 1329 in HR, that's 447 positions. And if we look at the current third quarter, it's up to 602. That's an increase of 34, nearly 35% of positions that are vacant versus those that are in HR. I'd like you to address that a little bit, just so I understand that growth. That seems to be a pretty large number, that 35% shift. But maybe I'm not looking at that in the.
So the number worked in HR, is the number of positions that departments have determined they are actively pursuing to fill at the moment, which may not be accounting for all of the vacancies we have in our organization at that moment in time, whether it was due to recent attrition or, repurposing of positions that we had to then take out of HR to then put through the cycle again with the departments as they're reorganizing. So there should always be a little bit of a gap there. We just cleaned up our data and found that it was a bigger gap. So between quarter 2 and quarter 3, we found that there was a technical coding glitch in how the data was being filtered from our systems into our metrics. And so now that we've cleaned up that, we got a more accurate count of the 1,200 that are currently in HR.
Well, that's probably what I was missing, an explanation of what occurred there.
Oh,
So
yes.
maybe going forward, just being a little more proactive and bringing those things to our attention, because that number
Yes,
is
sorry,
a
thank you.
rather large increase consistent from one quarter to the next. Thank you.
Yep. All right. And then our last slide is on our nursing update. So this talks about our nursing hiring velocity and attrition. Shows, continued steadily in the green where we are compared to from where we were last year. We've had 281 offers accepted for fiscal year 24. For the external new hires, we have 193 in fiscal year 24 as of the end of July, which is a little over 50 more than we had year to date last year. So we're seeing that progress continue. And separations, we have fewer of those, which leads to our net new number being much higher this year than it was at the same time last year. So this year we're at 70 net new hires for nursing when we take into account turnover. Year to date, same year to date number from last year was -1. So we are significantly in the positive compared to where we were last year at the same time.
Dr. Peters, any comment? Please. Any comments or thoughts on our nursing hiring and our nursing staff?
Nursing still, we have one of the highest vacancy rate, but this is the positive outcome we are looking, compared to last year. But we do have a long way to go.
So we're going to continue the fairs?
Yeah.
And the program that we started, what was the
Accelerated
Accelerated
hiring
hiring.
program,
Okay.
that is also working, and we're looking at each step of the process and see what else we can do.
Okay, thank you.
Lots of focus on retention. That is where, the managers and leaders are really owning that process of retention.
Thank you, we appreciate it.
Thank you.
I know I'm put you on the spot. See, you're here now, so.
Well, I'm curious about, are you seeing even more data to support what are the levers for being successful for retention? What are the things that help
Yeah, I'm
drive
happy.
success there?
Happy to share that we started a nursing retention committee that included the frontline staff. We also invited our, NNOC partners because it's a true collaboration. So part of that, they look at the separation and come up with different ideas. Like an example, I personally meet with all the new hires quarterly. I only go in with the 2 questions: what is working well? Why did you join? What else we could do better? And they give us a list of things, and we work on it. Like an example, there was concerns came about our orientation onboarding package. We revised that, so that way the plus things are great. And so there's a number of things. We are also one of the learning from is they wanted to talk about their future. So then we started a meet and greet program with a different level of nurse leaders, so they can, the new generation, like they're not going to stay at the bedside the way we used to. So we have to help them. So that's helpful. So a number of things we are doing to bring that. We also have a program, the residency program for nurses, which is one of the best in the country for the last 15 years. We initiated that here in 2022. I think we are at the 8th cohorts now, so that's working really well. Lots of focus on evidence-based practice, and many of our nurses are getting out, means new nurses, and presenting their posters outside. So I think they feel like the ownership of the practice of nursing.
Thank you.
Thank you.
both. Thank you. Directors, thank you very, very much for your, and all of you, those who presented and participated today. Thank you all for your engagement. As the agenda is exhausted, the chair declares this meeting adjourned.